Hey Brainiacs, I wanted to show you a couple cases that I recently finished up that I'm pretty excited about. We've been doing the SimplyClear aligners since August of last year now, and some of the original cases have been finishing up, and I've been thrilled with this plastic. I do want to show you guys a couple cases here of, moderate to severe malocclusions that treated out in under a year. So for this first patient, she started in September of last year. So this is the day I got the records. She probably got her aligners around the end of September. But we can see with her malocclusion that on the upper arch, the centrals were rotated. We had this lateral incisor tucked behind, rotation in the bicuspids. She's got a non-coincident smile arc there. And for the lower, so all her posterior teeth tucked in toward the lingual, pretty severe crowding on the lower anterior. So both 23 and 25 tucked back toward the lingual, not enough room for those teeth. So definitely a lot of movement that needed to occur to get her teeth lined up. We can see the bite was pretty solid, class 1 on both sides, but everything tucked in toward the lingual. So for her setup, it was planned for 15 aligners. Now, I do feel this was a little bit fast, but she wore them like a champ and they ended up working out really well. We did some IPR on the lower anterior, but as I talk about on a lot of the videos, we wanted to open things up at the start of treatment, bring those lower incisors forward, upright those lingual display or lingual tipping of the posterior teeth, and bring those incisors forward. For the upper arch, same thing. As we open things up, we can derotate and align nicely. So 15 aligners, so that was about 4 months or so. She came back in February. I didn't get updated photos, but I can show you where we got to at that point. So this is the initial aligner on her refinement. And unfortunately, my partner did go a little heavy on the IPR, so she had some spaces, but going from that severe crowding, got pretty nice alignment here on the lower anteriors, and the upper was almost perfect. Everything derotated, and this lateral came out toward the facial, really nice. So on the refinement, just a little bit of detailing on the upper arch there, and for the lower arch, closing those spaces and derotating that last little bit. So then when we look at the final photos here, which were obtained beginning of this month, so from end of September last year to beginning of June this year, that's about 9 months or so, 10 months. She's got a really nice smile. She's super happy. We corrected the non-coincidence of her smile arc. When I look at her upper occlusal here, really nice arch form. All the rotations are gone. For the lower, is it perfect? No, but pretty nice, and compared to where we were, she's thrilled. So super happy with that. We kept a really nice bite, so no open bite in the posterior, solid socked in posterior teeth. Again, that leveling of the arch, which she really needed, and a sound posterior occlusion. So super happy with that one. Like I said, only about 10 months or so. Now here's another case here where patient presented with a pretty nice smile, but lots of lower crowding. So when I look at his upper arch, he's got a narrow tapered arch form, pretty significant rotations of his central incisors that are tucked behind his laterals. For the lower arch, lots of crowding in the anterior. So pretty significant overlap of all these teeth here. And he's got a deep bite. Let's see if I can zoom in here. I don't know why this photo is smaller, but deep bite of about 50 to 60% there. And so we wanted to open up his bite, align the teeth, but when I was communicating with his dentist, he's got some recession that he's had for a long time, and they've been managing it. So the dentist didn't want any proclination, and so we planned some IPR mainly on the upper arch to reduce any proclination of the teeth. So you'll see, while these teeth do come forward, we didn't accentuate it too much. So on those central incisors, they came forward. Really, the other teeth did not. Now in the upper arch, where we did more of the IPR, they didn't come forward at all. So I'll turn the superimposition off, and you can see rounding out that arch form, derotating those teeth. On the lower arch, aligning there, you notice we over-engineered the facial movement of these central incisors here, because I know that clinically, when we compare the digital setup to what we see clinically, these teeth are going to come up short. So I wanted to over-engineer that, trying to get to that ideal alignment without needing a refinement or at least minimizing. Also, I wanted to open up his bite. So we're going from that deep bite there, and we planned it out to finish with a minimal overbite. Again, I know this movement's going to come up short. At the end of the first set of aligners, this is where we got to. The bite definitely opened up, and look at that alignment. Almost all the crowding fully gone. Tooth number 25, still a little bit lingual, even though we over-engineered that movement. So on the refinement, bringing that forward a little bit more and aligning to ideal there. For the upper arch, we got nice rounding out of the arch form. The rotations on 8 and 9 came up a little bit short. So on the refinement, we detailed that a little bit further. And this is where we got to. So here's his final photos here. Nice smile. The bite is opened up. Really nice arch form on the lower here. Class 1, nice solid socked-in occlusion here in the posterior. Coincident midlines. Posterior bite on the other side is really nice as well. And we got a good alignment for those upper anteriors. So again, for this one, he started in August of last year. This is when we got the records. So he probably didn't get his initial aligner until the end of August. And we finished up in May. So again, really nice, well under a year for a moderate level correction. So as I finish some more cases, I will send you guys some more case reviews, but I just wanted to show you those and let you know that I'm super happy with how these aligners are treating out. Thanks, and have a great day.